Have you ever felt tired that just does not go away even after rest? Not the kind of tired you feel after a long day, but a deep tiredness that stay for months or even years? Today I want to talk about something very important that many cancer survivors experience, but not enough people talk about. It is called cancer-related fatigue. This video is based on a large peer-reviewed study published in 2025 in the British Journal of Cancer. The researcher followed thousands of cancer survivors for many years to understand fatigue, why it happens, and why it matters. Let's talk about what they found in simple and clear words. First, what is cancer-related fatigue? Cancer-related fatigue is not normal tiredness. It does not always get better with sleep. It can affect the body, the mind, and emotions. People describe it as feeling weak, slow, foggy, or drained even after resting. This study focused on people who survived breast cancer, prostate cancer, and colorectal cancer. These survivors were 5 to 16 years past their cancer diagnosis. This is important because many people think fatigue only happens during treatment, but this study shows fatigue can last many years after treatment ends. The researchers studied over 6,000 cancer survivors and compared them to people who never had cancer. They found something very clear. About 1 in 3 long-term cancer survivors still had serious fatigue years after diagnosis. That means even after surviving cancer, many people are still struggling. The fatigue was not just physical. The researchers looked at 3 main types of fatigue. One was physical fatigue, like low energy, weak muscles, or feeling heavy. Another was mental fatigue, like trouble thinking, focusing, or remembering. And the third was emotional fatigue, like feeling worn out, emotionally unmotivated, or overwhelmed. Many survivors had more than one type at the same time. Now, let's talk about what makes fatigue more likely. The study found that fatigue was linked to several factors. Older age mattered. People who were older were more likely to feel fatigued. Cancer treatment mattered too. Survivors who had chemotherapy were more likely to have long-term fatigue. Other health problems mattered. People with depression, heart disease, diabetes, or other chronic illness had higher fatigue. Lifestyle also played a role. Survivors who were less physically active had more fatigue. And people who reported more emotional stress or fear about their cancer also had more fatigue. So, fatigue is not caused by just one thing. It's a mix of physical, mental, emotional, and social factors. Now, here is the part that surprised many researchers. Fatigue was not just about comfort or quality of life, it was linked to survival. The researchers followed people over time and looked at who lived longer. They found that cancer survivors with high fatigue had a higher risk of death compared to survivors without fatigue, especially physical fatigue. Even after adjusting for age, other illness, and depression, fatigue still mattered. That tells us something very important. Fatigue is not just feeling tired. It can be a signal that the body is under stress. This does not mean fatigue causes death, but it may show that the body needs more care, support, and attention. Now, let's pause here. If you are a cancer survivor watching this, or a family member or caregiver, I want you to hear this clearly. Fatigue is real, it is common, and it is not your fault. Many survivors feel guilty or weak because they are still tired years later. This study shows that fatigue is part of survivorship for many people. So, what can be done? The study did not test treatments, but it did give us important clues. Because fatigue is linked to many factors, it needs a whole person approach. That means not just focusing on cancer, but on the entire person. Physical activity matters. Even gentle movement like walking, stretching, or lighting strength exercises may help reduce fatigue over time. Mental health matters. Depression and anxiety were strongly linked to fatigue. Getting mental health support is not a luxury. It is part of cancer care. Sleep matters. Sleep problems were part of fatigue for many survivors. Talking to a doctor about sleep is important. Other health conditions matter too. Managing blood pressure, diabetes, heart disease, and pain can help reduce fatigue. And social support matters. Feeling understood, supported, and believed can make a real difference. The researchers also made an important point. Fatigue should be screened, even years after cancer treatment ends. Doctors often focus on cancer recurrence, but survivorship care should also focus on symptoms like fatigue. If fatigue is ignored, people may suffer silently. So, if you are a survivor, here are a few simple things you can do. Tell your doctor if fatigue is affecting your daily life. Do not assume it is normal. all or that nothing can be done. Ask about physical activity program or rehabilitation. Ask about mental health screening. And ask if your other medical conditions could be contributing. If you are a caregiver, watch for signs of fatigue, not just sleepiness, but changes in mood, thinking, or daily activity. Offer support, not pressure. Fatigue is not laziness. Now, I want to speak directly to survivors for a moment. Surviving cancer is a huge achievement, but survival is not just about being alive. It is about living well. This study reminds us that long-term symptoms matter. Your energy matters, your mental health matters, your quality of life matters. Cancer care does not end when treatment ends. And finally, a message of hope. Fatigue is common, but it is not something you have to face alone. With the right support, many people can improve their energy, function, and well-being. Research like this helps doctors and health system understand that survivorship needs ongoing care. Thank you for being here and listening. If this video helped you, consider sharing it with someone who may need it. And remember, your tiredness is real and your health still matters.